I want to also just begin by thanking Victorians for the amazing job that they have done in coming forward and making us one of the most vaccinated places on earth. That has allowed us to the position we are now in, where we are open and active for Christmas and the New Year and the holiday period. We have every intention of keeping it that way, as Victorians have worked so hard over the past 21 months of this global pandemic to get us to the point where we have 92% and rising of double dose vaccinations, and now that third doses are increasingly becoming available, the importance of coming forward for third doses to keep us exactly in that position. And in that regard, when we have 92% of eligible Victorians double dosed, the public health measures that were due to expire this evening at 11:59pm need to continue on to make sure that that open economy, that festive season burst that we are now successfully enjoying, and the certainty for the holiday period coming up can be locked in. So we will be introducing under the new pandemic-specific powers legislation largely the existing arrangements of 11:59pm tonight, but with some tweaks that I wanted to go through. And those tweaks are of course informed in large measure by the relative uncertainty that the Omicron variant brings as we start to learn more about what that means, the advice that we get from the Australian, from AHPPC, from our public health experts, both locally, interstate and around the world, will very much inform how we stay open and stay safe going into 2022. And of course, that's about making sure that the hard work that families have done, that Victorians have done, is rewarded in this festive season that's coming up. Nonetheless, we are in a position to recognise that this is important set of restrictions and public health measures that we're putting in, and I want to thank everyone that's been involved and given me guidance and advice in how to land on these decisions. The changes that we will be making in the public health orders from the existing arrangements go to the following. And that's all about maintaining the pillars of our vaccinated economy. Firstly, people who are under 18 will no longer be required to show proof of their vaccination status at hospitality venues. Currently that arrangement is, because of the 12 and above, that's at 12. But in terms of ease of arrangements, particularly for families at Christmas, lifting that to 18 makes a lot of sense. Secondly, the mandatory vaccination requirement when it comes to non-essential retail and retail more broadly will be lifted, except for hair and beauty services, and the mandatory vaccination requirement will also be lifted when it comes to real estate, largely an outdoor setting, very safe, people aren't hanging around for long, and also for places of worship, particularly when it comes to weddings and funerals. Masks will be still required in retail settings. Having said that, face masks in those religious settings, particularly at weddings and funerals or ceremonial settings, will not be required. If an event is held at a place of worship, there will not be any vaccination requirements or limits on participation. If that same ceremony is underway at a hospitality setting, then vaccination requirements will continue to apply, as they will continue to apply in all hospitality settings. Workplaces exposed to a positive coronavirus case will no longer need to undertake the same levels of extensive deep cleaning that they have historically. Mounting international evidence is that the coronavirus is overwhelmingly an airborne or droplet-borne disease, and the likelihood of becoming infected by touching a surface is increasingly seen as a low risk. Having said that, normal cleaning arrangements will continue to apply, and one of the benefits that we've seen is just the lift in hygiene as a result of the increased arrangements that we've had through the pandemic. Elective surgery rules will also be updated with more rural health services and regional health services able to step up and resume to 75% of normal elective surgery activity. These arrangements are modest changes to the existing infrastructure and scaffolding of the vaccinated economy that has got us to the point of firstly such high levels of vaccination and such high levels of being able to, for families, for businesses, for Victorians, for events, to be safely open, and that is very much our intent as we head into the Christmas and New Year period. One of the things that we can certainly do to make sure that we stay on that path is to get our third dose booster when it falls available. And there are currently, as a result of the changes that ATAGI, the Australian Technical Advisory Group on Immunisations, made recently, there are now some 720,000 people eligible for that third dose here in Victoria, having brought forward the interval from 6 months to 5 months. So please, whether it's at our local community pharmacies or whether it's at your local GP, you should come forward and get that booster as soon as you can as to how you go about planning for your summer. And of course, our state-run clinics will also be available to book in as well. Whatever you do to celebrate the festive season, getting vaccinated if you're eligible should be right up on your list. If you're out there shopping, book in and just pop by and see your pharmacist or your GP. If you're planning events and you're planning a holiday and you're due to get that third dose over that period of time, factor that into your thinking and your planning. It's the most sensible thing you can do. Our increased number of GPs, our increased number of pharmacists as the primary points of distribution of the third booster jab will be the keys, but equally our state-run clinics will also play a role. It's been great to see that we've already seen, since the ATAGI announcement, a 25% increase in attendances for third doses in less than a week. And we've seen that people coming forward in increasing numbers. That vaccine really will make a difference. It will make a difference to those people who are currently in our health system working, but it will also keep you out of the health system when it comes to coronavirus in whatever variant. And it's the story of the continued numbers, which Professor Sutton will go to in more detail, but it's important to note that of those people in hospital with coronavirus at the moment, none have received a booster, and while sadly they continue to be overrepresented in being non-vaccinated as well. We'll continue on with these efforts to make sure that Victorians get their booster doses, particularly over the holiday period. And I'd also take the opportunity to remind families of those with children between 5 and 11 that come the 10th of January, again under the national rollout rules, kids in that age group will be eligible for the safe, effective and free paediatric vaccine, and we would encourage again families to think about how they book in those arrangements over the festive and holiday season so as to make sure that kids get that and hopefully initial first vaccine before they get back to school, because that's the way in which we'll keep our schools open, protect our families, protect our communities and keep our economy safe and open. I might get Professor Sutton to make a few words and then we'll hear from Tom and then we're happy to take questions.